Tell me about this procedure that you pioneered, the in-bag morcellation.
All right, well, after doing hundreds of cases laparoscopically of taking out tumors that I thought were benign, I realized I had to develop a technique to treat even larger tumors. And after about 2014, the FDA put out that black box warning, uh, basically saying that morcellators weren't very safe unless it was done in a contained environment. So I developed an in-bag morcellation technique that I would use on these large tumors. Because trying to be a responsible surgeon, the options were either to develop an in-bag morcellation technique where I could contain all the parts of the tumor, or to cut the patient wide open. And I really thought that wasn't the best thing for my patients, to cut them wide open. So over the course of doing hundreds of cases laparoscopically, I developed this technique that's a little different than other in-bag morcellation techniques. My technique relies on bringing the mass up to the instruments as opposed to going after it with the instruments, and using just blunt instruments to make sure you don't rupture the bag in any way.
Okay. What are we looking at here, Doc?
Well, as you can see on the model on the right, I've gone ahead and drawn the incision that you would usually have for an ovarian cancer staging procedure. You got a very large 19 centimeter incision. It's a midline vertical laparotomy that goes around the belly button. And that's really what you need to remove. You need an incision at least of this size to remove a 17 centimeter tumor.
Okay.
And using my technique in comparison, and using this retrieval bag, we were able to make just a very, very tiny 1.2 centimeter incision in the umbilicus, which we were then able to stretch around this device, which is about 1.5 centimeters in total diameter, or a little bit smaller than a dime. And then after we get this device inside the abdominal cavity, that's when we can go ahead and deploy the bag and then scoop up the mass. So we stretched the 1.2 centimeter incision without a port to go ahead and fit the 1.5 centimeter instrument here. So we're talking about a really small hole, smaller than the size of a dime in diameter. And then of course, once we have the tip of this instrument in there, that's when we'll deploy the very large bag, and then we can scoop up the mass, and then by exteriorizing the mouth of the bag, we can take it out piece by piece safely without worrying about spilling it back into the patient's abdomen. So if we can pretend the tip of this is in the patient now, I'll go ahead and deploy the bag, and I'll show you what that looks like. This is the bag we'd use to scoop up the mass. And you can see it's quite a large bag. You could use it to pick up a mass. It's actually 23 centimeters in depth, so we were able to remove a 17 centimeter tumor with it. You could remove quite some large tumors. Here we got a representation of a tumor in the bag. There aren't actually no watermelon tumors, thankfully. But then once you have the tumor or the mass within the bag, you can go ahead and close the mouth of the bag and then seal the tumor in, and it actually sews it shut. And that's the next step before you exteriorize the mouth of the bag. And then you pull that through, and you end up with the mouth of the bag outside the patient, giving you a nice plane to attack the tumor with without fear of spilling the tumor. Okay. And then once you've got the tumor in the bag and the mouth of the bag is exteriorized or outside the patient, my specific in-bag morcellation technique is to take large coker clamps and place them on the sides of the bag, such as this. And then that gives you the ability, after you've got a few of these on there, to twist the coker clamps. And then that keeps the bag constantly taut against the skin. By keeping these bag edges taut, there's no possibility of fluid or cancerous cells leaking back into the patient. At this point, when you've got it taut against the patient's abdomen like that, I then use only blunt, curved instruments to remove the tumor piece by piece. Now, I'm not going to be able to take this tumor apart piece by piece, but normally this would be the process to remove the tumor until the entire tumor mass is out. This could take quite a bit of time if it was a very large tumor.
Like when you say quite a bit of time, an hour, 2 hours, yeah?
Yeah, the longest I've had it has been an hour and a half for a very large tumor.
Okay.
And does it just for my own information, is it like peel off? You're ripping it apart, or?
Well, it depends
because it's dull, right?
Depends what kind of tumor. The cystic tumors, like you said, can peel apart. As you grab one cystic area, it'll tear away from the rest. Solid tumors can be more difficult. It can be like tearing apart a hard steak or a hard piece of meat, where it really doesn't want to come apart piece by piece, in which case you'll have to twist and maybe use some different instruments.
But nothing sharp.
Right, nothing sharp. The last thing I want to do is break this bag and spill cancerous material back into the patient's abdomen.